He's been as enthusiastic as anyone clapping for carers. But up until yesterday, the Prime Minister was still insisting that they and other health workers who come here from abroad would have to pay £400 a year for the privilege of using the NHS themselves.
Thank you very much. Sit here at the NHS, all our carers. Thank you all very much. Thank you.
But tonight, after lobbying from Tory backbenchers and pressure from Labour, a dramatic U-turn.
The Prime Minister has asked the Home Secretary and I to work on how we can remove NHS and care workers from the NHS surcharge as soon as possible. And I'm very pleased to be able to do that. I've already spoken to the Home Secretary and we'll be saying more on how we do this in the next few days.
It was at Prime Minister's questions yesterday that Sir Keir Starmer had called for a rethink.
Does the Prime Minister think that it's right that care workers coming from abroad and working on our front line should have to pay a surcharge of hundreds, sometimes thousands of pounds to use the NHS themselves?
Prime Minister.
Well, Mr. Speaker, I thought a great deal about this. It needs funding, and those contributions actually help us to raise about £900 million. And it's very easy, very difficult in the current circumstances to find alternative sources.
Ministers now say the contribution made by health workers does merit them being exempt from the surcharge, the move welcomed by one doctor tonight.
It's excellent news. It's one of the best pieces of news I've heard in a very long time. With everything going on now, hearing that news is very lifting.
Labour say it was just common sense.
We can't clap our carers on a Thursday and charge them to use the NHS on a Friday. So he's been challenged. I asked the Prime Minister to reconsider. He's done that. He's U-turned. This is a good thing.
For thousands of carers, nurses and doctors, it's certainly a huge relief amidst all the pressures they currently face. Well, this was an astonishingly rapid U-turn by the government, and it came less than 24 hours after another U-turn whereby they'd allowed those who are bereaved during this crisis to stay indefinitely in this country. The Royal College of Nursing this evening welcomed the U-turn on the issue of whether people have to pay the surcharge, saying that they'd been campaigning on it for many years, but they said it was unfortunate that it had taken a pandemic for the government to change its mind.